Good morning in TV land. My name is Gabriella. I'm a dental hygienist in the upstate New York area. I'm licensed in dental hygiene, dental assisting, nitrous oxide, local anesthesia, and I've been practicing for over 10 years, pushing 10 years now, excuse me. So the reason why I come to you today is not because I have sponsors. I have nobody that really helps me out with these. I just kind of open my laptop and try to answer some questions that parents come to me on a daily basis. So today's question is, why does my baby's breath smell so bad? Good one. So there's multiple reasons why our child could have bad breath. And a lot of times I find that doctors will touch base on some of these things, but a lot of times they worry. They're not a medical doctor, so they're a medical dentist in that sense, but they're not a medical doctor, so they say, well, check with your doctor, even though they might have some inkling on what might be going on. So I want to answer those questions for you, okay? So when I have a child that comes to me, the first thing I do, because my profession is in dentistry, is I'd like to check their teeth. I want to look in between their teeth. I want to look on the biting surface. So if you're in your child's mouth on a daily basis and you're brushing their teeth, if you don't see any obvious signs of decay or cavity or stain or an area that is a little bit sensitive, then we want to look at other things. So first thing would be the nose. If the child has a lot of discharge, a lot of different colors, things that are running, back of the throat, that could dry on the back of the throat and actually cause a lot of smell. So that's one source. I always say, let's find out what's going on there. If it's just allergies, what can we do to alleviate that? And then second, going to the throat, it could be the tonsils. I have a multitude of kids that come to me and they have, this reoccurring strep throat. Now that actually plays a role because now we have bacteria, we have scar tissue depending on how severe it was, and these divots that are in the tonsils that just hold so much bacteria. So that could be a reason too. So if we have a kid that's been chronically ill, the bacterial load's going to be a lot higher. So then I say to them, please go see an ENT, see your physician, and ask them if they think an ENT would be the best source. Because ultimately it's going to help your child in the long run, right? Because if they got bacteria in the back of the throat that they're chronically trying to fight, it's not helping them. Okay, and then the third thing I would say is their tummy. This is a big one that parents don't think of. Our children have a lot going on and they're growing, and a lot of times the acid in their stomach is off, okay? Now that's where the most of our immune system comes from, is our tummy. So if something is a little acidic or they're having heartburn or anything to that nature, it's going to come up and we're going to be able to smell it. I know that dentists don't usually like to say this, but children should be taking probiotics. Check with your physician. Talk to them in regards to probiotics. Say, what is this with probiotics in children? Does it really help? Now, in our stomach, we have bad bacteria and good bacteria, and you always want that to be level. So a probiotic actually feeds and helps the good bacteria. And now there are foods that are prebiotics that are just vegetables and fruits and things that are healthy to help that balance again. So talk to your physician in regards to that. If you're like me, I don't like giving a lot of medications to my child. I don't like anything to do with that. So I try to find healthy, natural alternatives. So if we have a smell that's coming from the baby's mouth and it's not their tongue, you're brushing on the tongue and there's nothing coming from that. If you're flossing and you've seen your dentist and there are no cavities present, then we know it's the nose, the throat, or the tummy. So really quickly, saltwater rinses always work. They reduce the inflammation. They kill some of that vicious bacteria. But again, you know how kids are. They're not going to do that. So check with your doctor. Find out what they say. Maybe there's some natural alternatives. If everything else is nice and healthy, then I would encourage you to floss. Floss, 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 floss. All right, again, I will be making more videos. I want to do some reviews on different toothpaste, fluoride-free toothpaste and mouthwashes. And please submit any questions. And I guess I will be adding more questions that I get on a weekly basis. Thank you. Bye now.